G'day there, it is Jono here from The Hive. Now, have you ever noticed how really awesome practitioners, they just have this ability to ask the right questions so that they can then zero down on a problem that the patient has. Tony Robbins, he always says successful people ask better questions and as a result, they get better answers. So in this video, I'm going to share one of those better question frameworks that we use here at The Hive. It's called SPIN. Now, it's simple, but it's actually a really powerful way to uncover the real issues so that you can find meaningful solutions for your patients or your team. It could be whether you're talking with a patient, it could be with your team members. Again, even broader than that, could be when you're just trying to uncover something or go through a process with anything or someone else in your life. Now, here at The Hive, of course, we love our models and our frameworks because they make teaching and coaching much easier. And if you're an experienced practitioner, you probably need these kinds of things a little bit less. However, this framework, the SPIN framework, is particularly good if you are coaching a new practitioner. Something I highly recommend that you introduce new practitioners to, and it'll just be another tool that they can add to their kit of clinical and interpersonal skills. It'll help them get really, really clear really fast. So first, here's the breakdown of SPIN. I'll chat about how you might then use it in the consult process after I break it down. So it starts with the S, S-P-I-N. S is for situation. You start with this to get the basic facts, what's going on, when did the problem start, what's involved, who's involved. It's about getting that big picture situation so that you don't jump to conclusions before you have bigger picture context. SP, P for problem. This is where you need to dig into what's the actual pain point, what's bothering you. You need to get to the crux of the issue, whether it's with patients, I guess. Again, it could be a recurring injury or something, but it also could be, the way that one of your team members is showing up in the practice in a way that's maybe causing conflict with other people. So this is the drill down, the P, the drill down stage to find the problem. SPI, I is for implication. So if you're treating a patient, you've got to remember it's not just the sore limb or whatever that you are treating a whole person. So I, implication, it's about uncovering why does this actually matter to the patient? What are the ramifications if we don't fix this thing, or how's it going to affect the team if we don't fix this thing? If you understand the impact of something, the stakes are raised and it motivates a person towards action. So SPIN. Final N is need. What is needed to move this forward? What do we need to do right now? Who's responsible? How are we going to measure success? All of those kinds of things. SPIN. So you can see it's actually a really simple one. I know in our Optimus program we have a slightly more sophisticated consult framework, but I think particularly with new grads, this simple 4-part acronym is really helpful. Here's a situation. You might have a new patient, they come in, and in the background, your new grad might be thinking, okay, S for situation. What are the current activities in this situation that they're involved in? Is there any history related to the current presentation that they've showed up with? SP, problem. Where does actually, go through the pain? Where is it? When's it worse? When's it better? How does movement affect this particular problem? And then implication. Now, this is where I reckon it's actually really important or helpful to think about this. It helps you remember to show that you care about the person and why the problem that they've presented with needs to be fixed in the first place. So if you've been studying problems and solutions at uni, it's so easy to forget about this, but understanding the implication for the patient is really going to help you get the patient's buy-in to the next step. So SPIN, and they got this going. Okay, now what do I need? I've gone through the implication, I've got the buy-in. Okay, here's the treatment plan. This is easy, step by step. And since once you get to that N and you've already gone through the I, you can tie whatever your prescription is into it, i.e., you need to do this so that it has this kind of positive result in the context of your life. So remember, better questions lead to better answers. And why don't you give spin a spin? Let us know how you go. And I guess, as always, if you'd like to talk about how spin or any of our other frameworks could be applied in your specific practice situation, schedule a call at hivepractice.com/chat.